Tonight, a national outbreak of the parasite cyclospora. It is now blamed for infecting people in Massachusetts.
State public health officials confirmed today they have seen a big increase in the number of patients diagnosed with this foodborne illness, and they say some of them develop symptoms after eating the recalled lettuce at local restaurants. So joining us now is Dr. Todd Ellerin from South Shore Health to lend his expertise.
Good to see you both.
Yeah, great to see you. Thanks for being here in the 5 o'clock hour. So as you know, Massachusetts sees cases of cyclospora every year, typically in the summer. How do we know for sure it's the lettuce making people sick and not something else?
Look, you're right, Erica. We do see it every year, but the past increase over the past month, seeing more than 100 cases, that's more than we often see in the entire season. Also, we know that there have been clusters within Massachusetts, and we know the contaminated lettuce did reach Massachusetts. So we know probably many of these or some of these cases are linked. But again, what's important to realize is increased number of cases does not equate to necessarily to ongoing exposure. Why is that? Because it can take a while for someone, first of all, to develop symptoms, right? The incubation period of cyclospora is not just a couple of days, it's usually a week or more. It can be difficult to detect through testing, and then it takes a while to report. So cases that we're hearing about could be and likely are before the recall in mid-July.
All right, so the company behind this contaminated lettuce, Taylor Fresh Farms, says it stopped distributing that lettuce to stores and restaurants on July 16th. So we're about 3 weeks beyond that date now. Do you think it's out of the food supply system at this point?
Not only do I think it's out of the food supply, Ben, but our Department of Public Health thinks it's out of the food supply chain, and that's critical. So again, that doesn't mean that the next month we're not going to see an increase again, but most likely, most experts are saying that cases are going down now.
So do you think people should be wary of eating fresh produce, or should we just always be careful?
Erica, Dr. T loves lettuce, and by the way, and I'm eating lettuce, okay? Because remember, it's not that lettuce has been contaminated. It's a specific product from a specific source, you know, within Mexico, and that has been recalled. So I think, obviously, especially if you're immunocompromised, if you're elderly, but all of us, we want to wash our fruits and vegetables because it's not just cyclospora, but other bacteria. But these are some of the most important nutrients, as you know. So we can't, yes, we can eat lettuce. I feel it's safe.
The benefit outweighs the risk.
The benefit outweighs the risk.
All right, Dr. T, good to see you.
Good to see you both.
Coming in.